Welcome back. The impact artificial intelligence is having on mental health is being talked about nationwide, and now those conversations are heading to Capitol Hill.
And one very familiar face from the Queen City made the trip up to the Hill to make sure that everyone's voice is heard and that the federal government supports the resources necessary to help people who might be struggling.
Licensed mental health counselor, author, and much more. Of course, friend of the show, Dr. Charise Johnson, joining us live from the nation's capital. Charise, thank you so much for taking the time to join us. I want to start right here. Does this kind of signify that they're taking this seriously, AI and mental health, and that we need to put a focus on it?
They're absolutely taking it serious. Over the last 2 days, we've seen leaders all across government, healthcare, technology, workforce strategy, and innovation together to not only focus on how do we make America AI ready because it's here, but also in healthcare and sensitive domains, how do we make sure that people are protected and directed to humans when necessary?
Charise, we know you speak today. We'll get to that in a moment about your topic and what you're planning to talk about. But as far as what you've been able to absorb, you were telling us during the break, it's like drinking out of a fire hydrant. You got a lot coming at you really fast.
Yeah.
But even in the last 24, 48 hours, what have you been surprised by? What have you kind of just found up there with all these experts coming together?
Yes, one of the most staggering statistics to me was that based on current research, 90% of Americans are still behind the veil when it comes to AI readiness. And so the U.S. Department of Labor actually just launched a readiness course to help people get basic skills on AI. It's free. So you can text the word ready to 20202, and that is definitely something that I want to get out to the community.
And Jason mentioned you are speaking today. So what are the biggest points that you want to get across, especially when it just talks about AI and our mental health? Because as we know, there have been some situations where those lines really get blurred and it can end in tragedy.
Yes, we're looking for ways to make sure that as AI is being built into different organizations or apps, that we are putting in operational frameworks that have escalation pathways so that if someone is in need, it flags it based on their patterns. And so that'll be a big part of the conversation that I have today around why that's important, the gap that we have now, because AI capability has advanced faster than the rules that we have around it. And we want to make sure that everyone is safe and knows the line between when to receive support through a Chat GPT or a Claude and when you actually need to speak with a licensed professional.
Charise, can you touch on that a little bit more? And I'm sure you've talked about it with colleagues there, just the more reticence we have from people now to go to ChatGPT or other, adaptive learning models instead of talking to a person, because you don't have to deal with, maybe you're embarrassed to say it out loud to a real human.
There are a lot of factors. We do know that mental health is one of the fastest growing use cases for AI, which means that millions and millions of people are using it by the day. Sometimes it's due to lack of access, right? Here's something that is free and available. Sometimes it's moments of crisis where it feels very necessary. But the reality is the need for mental health does sometimes outpace the accessibility in terms of insurance. So we're also all working together to determine how do we continue to use it as a tool to help people that may not have access to insurance or therapy. So we're not anti-AI, but we want to make sure that we're using it in a way that helps support people and helps maintain their dignity.
Charise, I want to go back to something you mentioned a while ago. You said that the Department of Labor is offering this free AI education course. You can text READY to 20202. I think that's great. If you're speaking to whether it's the grandparent generation, maybe parents of teenagers or young kids, like what advice would you give them? Jump head in, learn how to use this on your own so that you can educate those within, your family, or how would you advise going forward?
That was a big part of the conversation. I do think it's important for anyone all across the scope of age to learn as much as they can. And I recognize that everyone has a different level of comfort, and there are resources that are available, such as the one we just mentioned, to help you learn. I will definitely say for parents, it is important that you stay connected to the different AI capabilities and what your students may be using, and have those conversations around I can't be there all the time, and I know that you will share information. Let's talk about the difference in the information you share to a platform and the information that may need to come to myself or another professional.
Yeah, I think those are some great strategies, especially for parents, since the younger generation really is embracing AI. So Dr. Cherise Johnson, thank you so much, as always, for joining us and making us smarter. And we can't wait to see what you have to say on Capitol Hill today.
Thank you. Have a great day.
Queen City News Plus. Just search Queen City News on your smart TV's app store.